Joining us to expand the topic, talking about the dangers of a heat wave, South African Medical Association chairperson, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, very good evening to you. Thank you so much for your time. Lots of complaints around the dangers of a heat wave, and of course, certain elements exacerbated as we look at the Gapane community. They're also battling a water crisis. How best should we understand what a heat wave is?
A heat wave, it's a condition, where you find that we're experiencing climate change, and there's a frequency in terms of heat waves, and also the levels of heat in the environment is higher than it was before. This it affects communities in different areas, but it's a severe form of a sunny day, if you could put it in a simple language. Where you find that the day is very sunny, and it affects, people in different areas.
But in terms of one's body, one's health, what is the best way to understand the impact of a heat wave on the body?
Okay, thank you so much. Now what happens is this: if you are exposed to the sun, depending on how long you've been in the sun and whether you have protected yourself or not. So those are the issues that are important. But we've got what we call heat-related illnesses, but also there are heat-sensitive illnesses. So the heat-related ones are caused by the sun itself, where you find that you've got an emergency, like what they call a heat stroke, where you find that you've got severe symptoms in terms of your blood pressure going down. You find that you are confused, your heart rate is going up, you are dehydrated. All these things you need, emergency medical attention. But the heat-sensitive ones are those, like for example, if you have got kidney problems, or if you have a problem with your heart, and all these other things that are affecting you.
You talk about some of the symptoms. How can we alleviate some of these symptoms? Because the body will react during a heat wave in different ways.
I think the biggest issue is that communities need to prevent it. You always say that prevention is better than cure. What we need to do is first to avoid exposure to sunny days, going out in the sun or even working, because when you work, you generate internal heat, but also there's that external heat that comes from the sun. You will find that it will lead you to dehydration because you sweat a lot, and you also breathe faster, and you're losing water in the meantime. But the other thing is, you need to protect yourself. You might, especially your skin, you might need to want to put a sunscreen. There are different types of them, but any sunscreen is suggested, during a sunny day. You need to drink lots of water, but also there is a caveat there. If you have a underlying kidney problem, you might need to moderate your water intake, so that it does not drown you. So the important thing here is that you need to drink enough water depending on your condition. You would have been told by a medical specialist or medical doctor or a clinical staff, what is it that you need to do in this regard. So this is important. You may find that even in the workplace, you might want to work in places where there's no heat exposure, but also employers may need to adjust their timing in terms of their workers. You can't expose your workers in a very sunny day, especially if they are doing work that is so physical, that will make them sweat a lot or breathe faster and all these things.
The school holidays coming up, a lot of the children no longer going to school as the breakup period comes up. What advice do you have for parents, guardians who may be trying to look after children, and of course, children being children will want to play?
I think we need to pay attention, to weather warnings. If there's a weather warning, we need to be attentive to that. But also, if you've been given a warning, you then know how to adjust yourself, and even the kids, how to advise them, providing them with enough water, but also advising them not to expose themselves or play longer in the sun. But on top of that, you would want them to, put on the sunscreen so that they protect themselves. But to report, that's very important as well, to report if they develop the symptoms that we talked about earlier on, so that they get that medical attention, especially when it comes to dehydration. So those are the issues that I think that are very critical when it comes to avoiding a heat wave.
Thank you very much. Let's perhaps leave it there for now. Thanking South African Medical Association Chairperson Dr. Mvuyisi Mzukwa.